make my yes, everybody say, Herbs, I see you. Okay? So we are blessed. And we gotta stay positive in life, man. There are negative things going on out here in life, but we
Yes, welcome to the live stream here. Today is Monday, Monday is a better day. It's a good day for jamming up your brains after some good weekends and ups and downs of weekends. So today we're going to talk about something that is important. Today we're going to talk about something that is important, and we will move on slowly by slowly, and make people understand about medical issues. And medical issues are always the best to understand, because we live on a life of life is a life, and we need to know how to manage our bodies and our brains, our bodies and our brains. So I'm saying that our bodies and our brains, because of what? Because mental health also is a key. Jamaican uncle is here, my friends. Jamaican uncle is here, my friends. A big up Jamaican uncle for your continuous support. Your continuous support. This channel is because of you. It's because of you. So when you see me coming online, my friends, just know this channel is because of Jamaican uncle. So today we're gonna talk about headaches and nose bleeding. Something that disturbs people so much: headaches and nose bleeding. Yes, we're going to talk about nose bleeding and headaches. It's a Monday today. The topic is serious. The topic is serious. Nose bleeding is something that people don't understand, and sometimes we need to talk about it. So, my friends, welcome. If you are new to this channel, please come to the. If you don't see me, I'm in the background listening. Thanks, Uncle. I understand about it. So, if you are here watching and you are a new guy, come tell us at the chat where you are watching us from. Or tell me where you are watching from. Interact with us. Text me at the chat. Tell me I'm watching you from Kenya, Asia, Nairobi in Kenya, Kampala, Uganda, and subscribe. We need to grow. So growth is a very important thing. So if you are there and you like medical talks, you like mental health issues, this is the channel. This is the channel whereby you should come in and listen to what is going on, and also subscribe to the channel. Ali Miga, good morning, Dr. Ben, Uncle, and everyone in the chat. Ali Mig, thank you for being here. Thanks for tuning in. So you as people come in, if you are a new person, please come to the chat. Tell me that you are watching me from this country and this country. Yes, even USA, Russia. Me, I'm in Africa. I'm a doctor from Africa. I come live to talk about medical issues. So where are you from? Where are you from? Where are you watching me from? Double tap your screen if you are watching from your phone, and if it's your computer, you know where to touch that dial. So welcome. Today we are talking about nose bleeding. Nose bleeding is a very funny thing. Some people don't understand about nose bleeding, because there are people who are born just having this complication. There are people who get it rapidly out there. We need to talk about it. So double tap your screen, start liking if you, we talk about good things here. We talk about good things, and good things are nice to talk about, like health and mental health. So your likes, man, your likes, so that we increase the impressions out. When you give the likes, you're increasing the more impression people come in. I'm from Jamaica, but watching from the USA. Big up Alimik. So Alimik, we're going to talk about nose bleeding. It's a medical term for bleeding from the nasal cavity. bleeding from the nasal. There is a cavity here on the nose called the nasal cavity. It's a very common and benign sometimes. Oh, I've said it's common. Nose bleeding is very common to some people, and out there people suffer a lot from nose bleeding, you know. So guys, if you are tuning in right now, who you are watching is Dr. Benjamin, and don't just eavesdrop. Don't just eavesdrop. Come on, like the chat. Let's continue liking as we are watching. Now, this is an area of there are several things that of around the nasal cavity that may make you nose bleed. I'm making a meat helmet. Hey, Viper, when you come to my, continue making your meat helmet. Welcome. I tell you, all of you guys have subscribed. Viper and Italio the Big. Hello, sir. Good morning, Italio. Where are you watching from? Tell me where you're watching from. I know you are new to the channel. Subscribe and like done. Viper, continue making your meat helmet as you like the talk, as you listen. Kalimigi is saying, yes, nice topic. I bleed from one nostril sometimes. So today, you're gonna know why you are bleeding from one nostril sometimes. So, Viper, welcome to the channel. Italio the Big, welcome to the channel. Let's talk about nose bleeding. Have you ever nose bled? Do you understand why you nose bleed? Let's get to know. Italio from Guyana, and you, Italio the Big, I'm from Kenya. I'm a doctor from Kenya, Africa. I usually come here with mental health issues, mental talks, and medical issues. So if you have any questions that you need to ask, just ask to the chat and we will interact. So people, welcome our new friend Italio the Big, and welcome also Viper CC85, who is making a helmet from meat. A helmet from meat. Yes, let's continue. So in medical terms, nose bleeding is called epistaxis, bleeding from the vessels within the nasal mucosa, here within the nasal mucosa. Now, normal anatomy, you know, I like talking to people while I'm explaining and teaching. So now most nostril arise from anterior septum. Nasal anatomy. Let me draw the skull here so that you can understand. I want to draw the skull, nasal septum. I'm drawing the nasal septum. This is the mouth, and then it goes like this to differentiate. I'm drawing something that is called the nasal septum. The nasal septum. I want people to understand. Welcome, my friends. If you have not liked the video already, you should like the video. You see, you should like the video. You should like the video. You see. So, this is you. This is you inside. This is called the area here. The what I've drawn in red is called the nasal septum. It's called the nasal septum. This is the nasal septum. From here going down, it's called the nasal septum. Just a reminder that my time has changed to 2 hours after original time, which is now 2 p.m. 9 p.m. Kenyan time. So please check out it. Yes, I'll keep up on reminding people. Jamaican Uncle has changed time from 2 p.m. Georgia time to 9 p.m. which is 2 hours ahead, which is 2 p.m. Georgia time and 9 p.m. Kenyan time. So if you want to watch Jamaican Uncle, let's watch Jamaican Uncle at 9 p.m. Kenyan time. Stan's Kitchen, welcome to the chat. You are Kenyan in Africa. Oh my God, I love Kenya. I love Africa. Bulldog, big up, Italio the Big. I like it when people say they like Africa. I tell you, one day I'll make it. You visit motherland. You visit Kenya. Just tune up with me support me on one of the videos, be on my chats, and one day I'll make it that you come to Kenya, you visit the motherland. Now we are talking about nose bleeding. This is what it means. This is your head. Here where I've drawn with red is called the nasal septum. It's called the nasal septum. So Stan's Kitchen, welcome. Stan's Kitchen is saying, like the video for support. Have a blessed day. Thanks a lot, Stan's Kitchen, always. Hey, I could sing a song today, but I've remembered it's not Feel Good Friday. So let's continue about our talk. Most bleedings arise from the anterior septum. Anterior septum is here where the nose is. Septum, blood vessel. Septum means capillaries, blood vessels. Especially a vascular network called Kiesel-Bach plexus. It is called the little area. So there are so many blood vessels here, many capillaries. So most of the bleeding, my friends, if you are watching, starts from here. So you have two nodes here. There is the little area, and here inside, just as I have drawn, this side and this side. This area is Queen is here. Good morning, doctor. I am here to learn and support. Thanks, Queen. Welcome. Now, Queen, Jamaican, her uncle has changed its time from 2 p.m. Georgia time to 2 hours. That is 4 p.m. So if you are in Africa, you start watching Jamaican Uncle at 9 p.m. Kenyan time. If you are in Georgia, that is 2, 3, 4 p.m., 2 hours earlier. So Jamaican Uncle has changed time due to some issues and some complications. So if you are watching Jamaican Uncle 2 hours after, you will be seeing her lives and her premiers. Blessings for you to be here, Queen. So this is your nose. This is your nose here. So this place is called the Kiesel-Bach plexus. Kiesel-Bach plexus, or little area, is where you bleed from. So this area is rich in anastomosing arteries. From anastomosis. What is anastomosis? Anastomosis is an area whereby arteries have attached themselves and they are communicating. Let me draw them. You see the anastomosis. You see how they are communicating. Something like this. You see, something like this. Ayesha, let them say in Turkish. No, Dr. Ben, it will be 2 p.m. my time, not 4 p.m. Oh, 2 p.m. Georgia time. Sorry, 2 p.m. Georgia time. 2 p.m. Georgia time. Jamaican Uncle will be coming live at 2 p.m. Georgia time. So this is what is called anastomosis. This one. So blood comes and flows inside. So if you cut this artery, the blood here will come and still go the other side. You see, anastomosis is an area of communication of arteries, and also 2 p.m. east of Jamaica. You see this one. This one is called anastomosis. So an artery, a vein comes in. I'm trying to explain something, my friends. So this is what I'm saying. This is an artery. If you cut here, the communication to this artery will still pass blood the other side. If you cut the other one, the communication with this side will still pass blood to the other side. So this one is called, something like this is around here and here. So the area is rich on anastomotic arteries from 4 different areas. There is an artery called anterior ethmoid artery, sphenopalatine artery, great palatine artery, and superior labial artery. Most of them are divided. There are 4. So some here, some here. So welcome my friends, for those who are watching, you are new in this platform, like this platform, check on the videos that we have done, check on the good videos that you have done, tell us if what you want us to talk about, any medical issues that you want us to talk about, come drop us here, tell us which one, you know I do what you like, what you usually like. So today we are talking about nose bleeding. So I've said in simple terms, something like this is called an anastomosis. Let's say this one is anterior ethmoid artery, this one is sphenopalatine artery, and then we have greater palatine artery, and the other one is superior labial artery. So if you cut one, blood supply will continue, because this one, if we block it, the other side will receive blood. You get? So it is called anastomosis. So you have such thing, plexus here. It is called the little area. So sphenopalatine artery branches, more severe, harder to control. So these ones, you have let's classify the nose bleeding, because some people may just bleed normally, some people may be bleeding continuously. We want to know why some people nose bleed continuously. Welcome to the chat. I can see more people coming in, and you are not telling us where you're watching from. Come to the chat, tell us where you're watching from. You are watching Dr. Ben here from Kenya, Africa, known as Benjamin the Wise Guy, always bringing you good content of mental health and medical issues. So if you are here from this, you want to learn more, or you have a topic that you want us to talk about, come to the chat. Let's talk about it. And don't forget to subscribe, my friend. Don't eavesdrop and go. Don't just eavesdrop and go. Like the chat, and let's continue learning. You know, when you learn, some things, they come, and you can help someone one day, even if you are not a medic. Even if you are not a medic, you can help someone when it is not too late. So this one, I'm trying to find that picture. Okay, I want to draw them so that you can know. So we have anterior ethmoid artery, posterior ethmoid artery, sphenopalatine artery. Where is anterior palatine artery and posterior? This is anterior and posterior palatine artery. We have I'm trying to create something so that you can understand. Sphenopalatine artery and greater palatine artery. So let's classify this nose bleeding, because Aliniga said she usually nose bleed at one nose. So we have anterior epitaxis, most common. Anterior is here. Anterior is here. This is your nose, so anterior is here. So when you are nose bleeding from here, it says the anterior, something that is called anterior palatine artery, the artery that comes here, has a problem. You see, Queen Wholeness, hi, hey Queen Wholeness, welcome to the platform. We are talking about nose bleeding. Welcome to the platform. Hope you are doing good. Like and subscribe and feel Benjamin the Wise Guy giving a talk. So origin is from the little area, the veins, the atomostasis that are here. That is anterior. Anterior means in front. So here, just within here, deep, the plexus up, there is something called anterior, the little area, which is Kesselbach plexus. Visible bleeding from the nostril, common in children and adults. And when sometimes there are some things that can make you nosebleed, like high blood pressure. We will see them. We have posterior epitaxis, posterior nasal cavity. So when it is, you have posterior is here. Here it is called posterior palatine artery. Here, you see this artery that is dropping here from this area of your nose. It is called posterior palatine artery. You may bleed from it. So nose bleeding is called, you are bleeding from those areas: anterior palatine artery, posterior palatine artery, greater. This is called greater palatine artery. And then we have in front. So the little area is in front here. Here, let me draw it well so that you can see it. The little area is the one that I've drawn in here. The little area is here. That anastomosis. And then here below there are some arteries that rise like this. It is called superior labial artery. You can bleed even from them. So welcome, my friends. If you are watching today, it's your first day here, please tell us where you are watching from and interact with the people at the chat. Don't just watch, man. Subscribe, bwana. Hey, subscribe for this good information so that when I'm coming to lives and you are there and you are feeling nice and you are getting notification that tells you, hey, my friend, Benjamin the Wise Guy is online. Go check him out. Notification. So subscribe. And you even, if you have something in your account, you can go and be my member. Membership is good. Some people in the membership area, they are enjoying good videos and feeling good, you see, and feeling good also. Now, greater posterior artery comes up from there. So we have said that you can bleed from these areas. Here, or the little area, or the labial artery that comes up here, and when you are bleeding, it depends. Some people have arterial problems of bleeding. And we want to see, and we have a statistic here that our friend has told us that she usually bleeds from one part of the nose. We want to know why she usually bleeds from one part of the nose. Why? And why is Alimig? Are you still around? Alimig, if you are still around, please tell us how nose bleed often. Oh, now sit down, Queen Holmes, sit around and let's know why you nose bleed often. Alimig, which part of the nose do you know? The right or the left? And is the blood splashing, or you just feel it when you put yes, I'm still here. What I'm asking is, do you feel it, or do you see it dropping down? If you see it dropping down, it means you are bleeding from anterior palatine artery. If the left, okay, the left side, and then if you feel, sometimes it comes and then you do with a handkerchief, you feel it is clotted blood, just know you are bleeding from posterior palatine artery. Oh no, it doesn't drop. So Alimig, I may say you are bleeding from posterior palatine artery. I will tell you why as we continue. And then there are some that bleed from the sphenopalatine lingual artery, or the little area. The little area is anastomosis, something like some veins that are attached like this. Why? Because if this artery is coming here, and it is you, but when I touch, the blood is there. Yes, you are bleeding here. If this artery comes here, and this one may be something that happened to it, and this one is supplying blood. So this area down here will not lose blood because it is connected to this anastomosis. You cut this one supplies blood down here. You cut this one supplies down because it is connected to this anastomosis. So let's continue, my friends that are here. I can see Queen Wholeness. Queen Holiness, welcome to the chat. We learn 1, 2, 3 things, and then we go on happy. We go on happy and satisfied, and we do things that makes our body be healthy. You know, we make our things that make our body be healthy. Now we are where we are bleeding from. Now let's get to know. The causes. Let's get to know the causes of bleeding. What are the causes of bleeding? When you are taking, you have long nails. You have, ladies, listen, ladies. This is for them ladies, for my empresses. You have long nails and you are not speaking. When I use a prescription spray, it doesn't bleed. Yes, let's get there, and make. I tell you why. You are not speaking, and immediately where you are not speaking is this anastomosis, this one. So when you are not splitting, you injure this area. You will start nose bleeding. You will start nose bleeding. So when your nose, you know, your nose should be humid. Your nose should be humid. It should not be dry. Hey, my beautiful young sister is here. The one that I want to hear. I want her to come to Kenya to find someone. T-Beauty, welcome to the platform. Thanks for joining today. We are talking about nose bleeding. I'm waiting for you to drop down by a jumbo jet that is called the KQ, alongside Marcia Thompson. Marcia Thompson, be waiting for me next year as I land. I said when I land to Jamaica, the first person I'm going to see is Marcia Thompson. Marcia Thompson, with that one, be sure. When I land to Jamaica next year, with Jamaican uncle, because he'll be my director. You are the first person I'll tell, uncle, let's land where Marcia Thompson is. Yes, because Marcia Thompson was the first person to comment on my platform. I usually remember that. When Uncle started this channel. So big up Alimig, big up T-Beauty, big up Queen Holiness, big up Jamaican Uncle, big up Queen Stan's Kitchen, my new friend Viper, Italia on the big, Italia the big, all of you that you are here. We are talking about nose bleeding, and you see T-Beauty has just come and said no speaking made her to bleed. So if you are watching, we have 16 people watching but 6 likes. What are the 10 waiting for? You hit the like button, my friends. Hit the like button. Let's increase the likes, so that the impressions can come in, and then we become a bigger and the biggest and the big on. Biggest and the big on. So your nose, as we continue, let's increase the likes. If you like, you know, here in YouTube, if you like, it gives an impression to someone else. That someone, it tells that someone else that, hey, Benjamin the Wise Guy is live. Can you watch him? Those are called impressions. Nene and Mom said hi. Hi to everyone, Nene and Mom. Today I've resumed with nose bleeding. Greetings, Chadra. Hey, say hi to Nene and Mom, everyone. Now, picking. We have said, ladies, if you have long nails, stop picking your nose. You will injure the little area. This little area has something that's like this called the anastomosis. So you may injure it. And if you injure the little area, nose bleeding continues or starts. So let's continue, my guys. Dry air. Your nose should not be dry. It should be humid, because if this area of the soft palatine inside, if this area becomes so dry, it can crack. And what does cracking mean? It means that these blood vessels that are here may be affected. They'll be vulnerable. And vulnerability means cracking also. And then you will start nose bleeding. Benard Mab, welcome everyone to the topic of nose bleeding. And you remember to smile when you come to my channel. Smile like me, because I barely have time to sleep. My nose starts bleeding out nowhere. Why? Hey, T Beauty, my mom told me never ask a lady weight, but I will really love to know your weight. If you are okay, tell me. If you are not okay, don't. If you see you have long hours of work, you are not sleeping well, you are always up and down, and you start nose bleeding in the evening, relate that to high blood pressure and weak anastomosis. So let me repeat, because people are coming in and they may ask, what is anastomosis? At this area that I've surrounded here is something like this. It is called the little area. So anastomosis is connected veins, so that if this vein artery comes and connects, this one comes and connects, this one comes and connects, and the other one comes and connects. If you cut this one, blood will still be supplied. If you cut this one, blood will be supplied. This one, something like this is here. What did you ask me? I'm asking you your weight. How many? My mom told me never ask a lady the weight, and I'm asking now. T Beauty, you don't. 135 pounds. Okay, T Beauty is a good lady. T Beauty doesn't. Some ladies cannot give you their weight in pounds. In pounds. Why? I don't know why. Pounds in kgs here is 61, which is okay for T Beauty. It is okay. That is okay. I'm fit. But when you are having a very long day working, feeling headaches, and you're going down to sleep in the evening and you start having nose bleeding, you associate yourself with BP. T Beauty, one time, take your blood pressure and tell me how it is. Tell me how it is, so that we can relate. We can relate. We see how it is. So here we got. I was explaining about this. Anastomosis. I was explaining about anastomosis. Hope you have everyone understood what anastomosis is. Anastomosis is connected blood vessels around the nose, a place called the little area, whereby if you cut one blood vessel, the other one will still receive blood. Because if you don't do that, if you cut one blood vessel, within short time, this area will have been dead. So we don't want people who have, God is a wonderful person or a wonderful creature where he is. He knew how to bring out a person, So dry air and low humidity. If you have dryness, it may crack your palatine, and then you start nose bleeding from the vein. Infections, rhinitis, and sinusitis. So infections and rhinitis and sinus infections can make you to start bleeding. Infections. So when you get infection, the bacteria may injure your nose and the vessels, and you may start doing what? Nose bleeding. So foreign bodies. You have seen people that get piercings on the nose. Some of them, they go to wrong people and they pierce the nose wrongly. So you get, it has affected the little area where this anastomosis is. So when it is affecting the little area, let's say the anterior palatine lingual artery is attached or near. So every time you get an infection, the piercing that you have placed injures your your area, the little area. So you start bleeding. Dorothy, welcome. Dorothy, welcome to the chat. We are talking about nose bleeding. We are talking about nose bleeding. So nasal tumors. There are some people that have tumors. When I'm talking of tumors, I'm talking about cancers. They at the nasopalatine. So here I'm saying this one is called the nasopalatine area. Tumors can cause. So if you have a person that without no known reason, this person just starts to nosebleed, no high BPs, no dryness in the, you are just seated or you are sleeping and in the morning you wake up, you find blood in bed. Tell this person to go and be done some MRI so that we can see if there are tumors in around there. There are some things like systemic issues, Systemic issues means things like hypertension, high blood pressure, blood disorders like leukemia and hemophilia. Hemophilia is a bleeding disorder. We have hemophilia A and hemophilia B. We will learn about them, bleeding disorders, very soon. Even tomorrow we can learn about them. Those people that are on anticoagulants, blood thinners. There are some people who go to the hospital with high blood pressure and they are put on blood thinners. Guys, I'm working, blessing everyone. Thanks, Queen C. You are at the background and we feel nice that you are with us, Queen C. Maje from Jamaica, the land we love. Maje B is here and we thank you, Maje, for tuning in. Not forgetting my sweet friend, my beautiful sweet friend, the coffee cakes, my beautiful. You see, you see, I'm saying what? My beautiful sweet friend, the coffee cakes loving beach. Hey, good morning, doctor. Good morning, coffee cakes. Welcome. Big up everyone that is here. Watching and listening. Just listen, synthesize, and help someone else. You get it? Listen, synthesize, and help someone else. Now, vascular disorders. There are some people, that is another problem that causes problems, especially when people like our friend. It's a blessing having you around. Especially our friend that has said she is bleeding from one side of the nose, bleeding from last time I checked BP, it was 76 116 over 76. You see, I had to go find my paper first checkup. That's why I call you T Beauty. T Beauty, my young little sister. T Beauty, you may not have the BP always. You may may have, you can have a rough day. The day can be rough, sunny, with very many stress, and your BP rises once. It doesn't mean that you are hypertensive. So when you go to a hospital to check your blood pressure, it has gone back to normal. I will talk about it, T-Beauty. Don't worry, it's normal for 24 years old. Yes, it's normal. Now, ain't you mean 116 over 86? Yes, it can never be 86 over 116. It's supposed to be 116 diastolic and systolic 76. The opposite, maybe you have heart disease. Now, vascular disorders. Vascular disorders means that one of the vessels, let me put my picture here. You see, this is internal carotid artery. We have an artery called internal carotid artery. And then we have posterior ethmoidal artery. Posterior ethmoidal artery. And then down here, we have sphenopalatine artery. We have sphenopalatine artery. Here we have anterior. These the arteries. Posterior palatine artery, anterior palatine artery, palatine, it is called sphenopalatine artery, and then we have this anastomosis here, the little area connection of blood vessels. So one of these vessels could be weak, and you know you have this side and this side could be weak. The arteries walls could be weak. Then you can be bleeding from one side of the artery, one side of the weak artery. Where the weak artery is, the walls are weak, or the other side of the weak artery. Or you could be bleeding from down, or both of them. So it depends with what, that is called vascular disorders. We will check vascular disorders. Vascular disorders are common and they make people bleed so much. Sometimes you start asking yourself, I've been going through all the tests about nose bleeding, and everything is okay. Why am I just bleeding? I'm answering something. I'm answering some. If you have a question, what's normal BP? 120 over 80. The diastolic one should be, the above one should be at least 130 to 100. The systolic, the lower one, the diastolic one, should be not above 80. Not above 80. That's T asking what is the normal BP. So that is it. If you have a question, let's continue asking as we learn. So T-beauty at least less than 130, not below 80. That is the systolic one. But the diastolic one, not more than 80 and not below 60. When you start having of 55 diastolic, you have hypotension. You see. So let's talk about vascular disorders. There are several disorders that people inherit from their genetics that people have, like hereditary hemorrhagic telangiectasia. It's one of the problems that makes people bleed, dilated veins. Here it may affect one side or both sides. Hypertension related vascular fragility, hypertension, vasculitis, inflammation of blood vessels, atherosclerosis of nasal vessels, atherosclerosis, stiff and brittle. So one of your the arteries that I've named can have stiffness, and it becomes brittle. So you start bleeding. Capillary fragility, and it's seen in anti-aging mucosa. So as you age, you start reducing the immunity. And those people that have deficiencies in vitamin C, vitamin C is a cofactor. It makes your tendons tough, your skin tough. So if you have deficiency in vitamin C, vitamin deficiency, it leads to thin, easily ruptured vessels. So if you have not been taking your vitamins well, you are only like things that are not getting you vitamins. You see where you're coming from. You will start having nose bleeding. But atherosclerosis mostly is problems here, and hypertensive disease that may affect only one side or both sides. So let's check about it. Have you ever nose bled? Is it both or is it one side? Another thing, is it once in a while, like 1 year, or is it chronic? Do you nosebleed always? So if you nosebleed always and it is in one side, check your blood vessels. Do an MRI, check your blood vessels. One vessel could have, mostly, if it is the front, the anterior palatine artery could have clogged, or it could have something called atherosclerosis. If it is both and you are bleeding raw blood, when you are doing this, it is coming down like bleeding. Know that you are bleeding from the little area, the anastomosis that is connected, But if it is when you put your handkerchief, you see blood, no, it may be bleeding from the posterior artery. So I know I'm answering several questions that people have, and always, my people, every time you have a question, don't stay with your question, or don't stay with your question. Always come and ask these questions. Let's help people, because you may not be a physician, you may not be a clinical doctor, you may not be a nurse, you may not be anything professional, but these talks may help you save life. Because you are just listening, they may help you save life. You understand? Yes, important, very important. So T-Beauty, I've answered that question of blood pressure. Majay B, welcome. Today you are cool and calm, not cool and deadly, cool and calm. Dorothy K is around and Ali Mig now is answering herself about the nose bleeding. My friend who is Isis Skin, Iseke Skin is in the house watching and feeling. I've seen he has given us the brain icon. I think he is saying, I'm feeling my brain. Guys, I'm working. Bless. Jamaican uncle is busy somewhere, but he can be here anytime. Remember, Jamaican uncle has changed his time to 2 p.m. Georgia time. I think here in Kenya it will be 9 p.m. It is 2 hours from the normal time that he was coming. So if you are here watching and you want to meet Jamaican uncle again, 2 p.m. Georgia time, 9 p.m. East African time in Africa. Welcome my big supporters who are here, and just don't listen. Smile a bit. Give me an icon of smile like this. An icon of smile, and then we feel good. Yes, 9 p.m. Kenyan time. That is what the time Jamaican uncle will be coming with premiers because of some schedules that he cannot avoid. So let's continue about our nose bleeding thing. Our nose bleeding thing. Why do people nose bleed? Epitaxis occurs. It 9:19 a.m. in Jamaica now. Oh, and here it is 5:19 p.m. in Kenya. Marcia Thompson, it is 5:19 p.m. 5:19 p.m. in Kenya. Now, epitaxis occurs when nasal mucosa blood vessels rupture. In simple, I'm saying nose bleeding occurs when these blood vessels that I've named here, they rupture. Because of mechanical damage, trauma, you can hit your nose, you can pick your nose and damage your nose, and maybe your nose can be dry and cracking and expose the vessels. So when you feel that you are in a very dry place, please rehydrate. Always rehydrate. Guys, if you are watching and you are new in the platform, don't forget to subscribe and like. Subscribe. Always give a subscription so that we can grow together. Give your subscription and we will grow together. Inflammation is another thing. Fragile capillaries. Which one of those smiles would you like? You are laughing. T-Beauty, that is laughing. T-Beauty, you are laughing. That is a smile. Makes you not to age. Now, let's continue to talk. Inflammation, fragile capillaries. And I usually say the signs of inflammations are redness, swelling, Joao Batista, hello, good morning from Brazil. Our new friend, T-Beauty. We have our new friend from Brazil called Batista. Batista, welcome. Good friend of mine who always comes. And if Batista, you have a channel, please tell us you have a YouTube channel so that we can come there and see what you do. Good things you do. So Batista, hit the like button. Share this with your community where you are. Share this with your community where you are chilling, my friend. When you get new friends and you friends mingle in your chat, how do you feel? You feel nice, You feel nice, my friend. So let's continue. Coagulation effects. Coagulation effects are very immune. They are very complicated. People that are just, we will talk about coagulation effects tomorrow. Coagulation effect is those people that have problems with the blood. Those people that have problems with the blood clotting. You just bleed. You just bleed. You just bleed. Your blood cannot clot. Have you ever met someone who has coagulation effect? I'm still here, my friend, and yes, Jamaican uncle. Coagulation effects are problems. Because of vasoconstriction, your vessels cannot constrict well. Platelets form a plug. Coagulation cascade stabilizes the clot. You know, you have problems with platelets. You have platelets with factor defects. We'll see the factors that make you not to bleed. And there are some diseases also that make people to bleed. They are just not bleeding. If you are one of them, if you are really not bleeding here in this house, please tell us that we help you. We know your problem, and then we will launch a video to talk about it. Nose bleeding can make someone to have chronic hypotension, injuring some organs in your body. So, Batista, welcome. Coffee Cakes, Marjay B, everyone who is listening to Benjamin the Wise Guy, big up yourself and be blessed. Next time, if you come, share with a friend. Tell a friend that here we give ourselves some topics, and we make ourselves know 1, 2, 3 things to save life. You know that. Welcome, my guys. Welcome, my guys. And there are good things at the what is called the membership members area. So make a way there. Make a way to the member area, and you'll see some more things. Good things. The health is wealth. Yes. T-Beauty, health is wealth. If you are not healthy, you can't work. If you are not healthy, you can't work. Sometimes when I'm having a flu, I'm down, working becomes a problem. Working becomes a problem. But let's thank God that all of us, we are here and you are learning something. But now let's learn, and you teach me also good things. My friends, you, as we are learning something, teach me good things, how you do things at your area. When someone has nose bleeding, what do you do? When someone has nose bleeding, what do you do? Tell me, my friends, when you reach somewhere, I'm putting it and pinning it. When someone has the first aid, what do you do? What do you do? The first aid. What do you do? What do you do when someone has nose bleeding? So I was giving signs of inflammation. Signs of inflammation: one is swelling. Second is hotness, warmth, redness. You see? So when you have inflammation or a disease that is causing inflammation around your nose, you swell. When you are nose bleeding, you feel like it's like you are stuffed. It is not that you are having a flu, it's because this area of the palatine is undergoing inflammation and you are stuffed. You are feeling stuffy. So air is not getting in well. So one thing to do when you're getting these problems is trauma. You can injure yourself. Someone can injure you, can hit you. You can hit down. Infections, high BP. Then it brings this, it ruptures. When BP is so high, it ruptures these blood vessels. Then exposure, the nasal vessels are exposed and blood comes out. Blood escapes into capillary nasal blocks, and then you start seeing blood. This is when maybe you have coagulation problems. When you have coagulation problems. Hypertension, when you have high blood pressure, hydrostatic pressure is fragile. When pressure is so high and the capillaries at nasal palatine are fragile, they rupture. Some of them rupture and you start seeing blood. And this one makes sometimes, it is very hard to stop this unless you bring down the high blood pressure. You see, so what do you do when you are nose bleeding? When you are nose bleeding, what do you do? These things we do when someone is nose bleeding is very important because they save life. More nose bleeding can make a person to die because of hypotension. So you can bleed from both nose. I've explained how. You have seen blood may drip in the throat. You see, it is not only you are nose bleeding from the nose, blood coming out. If you are bleeding from posterior palatine artery, posterior, you may find blood from the throat. So when you are spitting, you're spitting blood. So here is, you see blood from the nose, anterior arteries. If it is the little area, the anastomosis, you see blood from the nose. But when it comes to posterior palatine arteries and the greater lingual artery, the greater lingual artery that comes here and then it goes up to the nose, that one, when you are nose bleeding, I know some people always think that nose bleeding just means when you are nose bleeding from the nose. Sorry, you always think only nose bleeding is from the nose. No, that one is very dangerous. Yes, that one is very dangerous. When you are nose bleeding from posterior palatine artery, you spit from the mouth because blood goes reverse. A little pressure at the bridge of the nose, stuff with tissues. If you won't stop, hospital may need to cut it. Yes, that is what you can do. But always, how do you lie? Coffee cakes. Do you lie like this or do you lie down like this? You see. So the coffee cakes is giving us how the first aid. A little pressure at the bridge of the nose, stuff with tissue. If it won't stop, rush to the hospital. Yes. First of all, if it is both nose and it is not stopping within 5 minutes, go to the hospital. My kiddo gets lots of with dryness. Yes, buy the kid some surfactants of the nose so that he cannot not backwards. Yes, so that he cannot be having dryness in the nose. It will really help. So T-Beauty says forward. Yes, forward, so that you cannot bring back your blood. But if you notice, you are spitting blood. You know, when you are nose bleeding from the posterior palatine artery inside, you start feeling humidifier helps me. Yes, very important. You start feeling you are having salon spray. Yeah, I can see people here are nice and they know tips. You see now, T-Beauty says humidifier helps me, and here we have the coffee cakes who says salon spray, saline spray. Yes, helps in winter. Saline spray because of the sodium. They bring, you know, when you have saline spray, the saline spray is sodium chloride. So the sodium moves water around. When you spray and you have sodium, it moves water around. So it becomes some humid. Your nose will be humid. And humidifier. Most of the humidifier has sodium. T-Beauty, most of them. So the most important thing that you need to know is it is not only the nose bleeding from the nose. You can even nose bleed from the posterior palatine artery and blood comes out of the mouth because it is going backwards. So when you start feeling you are smelling blood and you are telling people, guys, I'm kind of like smelling blood. Are you? And you spit blood yourself, go to a hospital. because the posterior palatine artery can bleed and bleed. You go run to a hospital. So both from one nostril and both nostrils, blood may drip into the throat, posterior bleeding, swallowed blood, nausea, vomiting. You see, when you swallow blood, some people swallow blood without knowing. Some people swallow blood without knowing, and then you start vomiting blood. Because when you swallow more blood, you may have nausea. So you start vomiting blood. You start when you start vomiting blood, you go to a hospital. They do abdominal checkup. They see you don't have any ulcers. They do several checkups. They see this person does not have any ulcers, but it comes to the nasopalatine area, you are bleeding. In severe cases, you get dizziness and shock. When it is posterior, it is unlikely for a person to get the cause. I remember using a saline rinse on my nose before, and it do magic, especially I live in Alaska, so cold. Yes, it does magic because it's a humidifier. Let's talk about management and reviews. How do you manage? How do you manage? We have just talked about how to manage. There is coffee cakes are said a little pressure at the nose bridge like this. So when you are touching your nose bridge like this, what are you doing? What you are doing, you are touching the little area here. That one helps when you are bleeding from the little area and the anterior palatine artery. Doctor, when I was young, I was taking nail out of the bone. I yacked it hard. The nail came, but it hit my nose with the hammer in process. Mother could stop bleeding, had to go to hospital. Yes, that one destroyed the area and the anterior palatine artery. So they went to correct it at the hospital. That is so painful. Sorry about that, coffee cakes. You know, this area has a lot of arteries. This area has a lot of arteries and nerves. So it was so painful. I can attest that one was so painful. So we are continuing about management. Or can I say anyone with I'm taking Coca-Cola now. Is anyone having any question? Anyone with any question? Before I continue to management, we see, because it's good to coffee cakes, when you injure a place that has got nerves, a place that has got blood vessels, it is very painful. That's why when you hit your nail here, it is very painful, because most of the nerves end up here. Most of the nerves end up there. So you guys, my guy, anyone with any question? Anyone with any question? Before we go to management, we go to any question. The coffee cakes, tea beauty, everyone that is here, welcome. Throw that Coca-Cola away now. I'm your doctor today. I've not eaten anything the whole day, and it is 5:35. I need instant, that's why I'm taking Coca-Cola. I need instant sugars so that I can continue talking. I need instant sugars, and I don't want to leak glucose. Coca-Cola is instant sugar. So guys, let's continue. Anyone with tea beauty? Just imagine waking up at 4, doing can the blood from your nostril get down to your throat as well? Yes, Alimi, it can. It can. Why not eat? Why not eat? I've not had any time to eat. So when I started the live, I told my sec, please give me even a Coke so that I can talk. And she has brought me a Coke, at least I talk. Let me answer, can the blood from your nostril get down. Yes, when you are pulling it in, you know, when you have something that is coming outside your throat, your nose, you feel like doing like this so that the airway can be open. So it turns back. But if it is posterior palatine artery, most of it goes back to the throat. So you may swallow it. Another thing is when you are having, and I want anyone, this is a very important thing. This is a very important thing. Are we listening? Coffee cakes, I don't like being full. Let me answer coffee cakes before I go to that. When I eat, I become lazy. I am my eating habits are bad. I eat too little, so I don't like being full. No, I like eating little so that I can become active. When you eat, you become lazy. Now let's talk about something that is very important when it comes to nose bleeding. If you hit yourself around the head, here, around the nasal area, and then you start to nose bleed, the bleeding stops. Hey, sorry about that. The bleeding stops. Yes, when you eat a lot, you start feeling lazy and tired. That is me. So my eating habits are so bad. Sometimes I just eat vegetables and I'm okay the whole day. So I eat at night when I'm going home. So this is my especially if you eat turkey. I have never eaten turkey. I wish I have them one day in my compound so that I can eat them. Yes, go veggies like me. Yes, I like vegetables, coffee cakes, tea beauty. So I was saying, when you have been nose bleeding and now you find out that the bleeding has stopped. The bleeding has stopped, but what is coming out of your nose is clear fluid. The bleeding has stopped, but what is coming out of your nose is clear fluid. Please don't blow your nose. Don't say that the bleeding has stopped. It is mucus coming out. If you have a running nose after nose bleeding, don't blow your nose. Do anyone knows why? Please let me hear you. Let me hear anyone if you know why. Anyone knows why I'm against blowing noses? You see, the coffee cakes I confuse coffee cakes and tea beauty. Tea beauty has said, I did that before and starts bleeding again. Reopen the blood vessels. Yes, when you blow your nose, it opens the blood vessels. But listen to me carefully. Listen again. You have been bleeding. You have been having a nose bleeding, and then the nose bleeding stops. What you start having from your nose is clear fluid, like running nose. Clear fluid, like running nose. What do you think might be happening? What do you think? Yes, Coffee Cakes has answered that. It may be cerebrospinal fluid. You may be bleeding from cerebrospinal fluid, which is very complicated. You know, when you injure, mostly when you hit yourself here, there is a plate here that is called Klippel plate. It is like this. So when you hit, it opens. And that is why people get meningitis a lot from this area of the nose. You know, meningitis. Because in the cerebrospinal fluid, the fluid that holds the brain, this is the weakest place. And here, there is another place here, that's the temporal lobe, that is very important. If you hit a part here, that person can die very fast. So, when you have hit yourself on your face and you are nose bleeding, another clear fluid after the nose bleeding has stopped starts to go, don't do anything. Stuff your nose, run to a hospital. And you know what? The other thing is, you may lose your sense of smelling, because where the cranial plate comes in is the first cranial nerve that is called olfactory nerve. Yes, triangle of death here. Triangle of death. Coffee Cakes, thank you so much for reminding me. You see, there are several things in your head that you really need to know. Yes, I was answering that one. So you run to a hospital. Why? Because if you find out that you are not getting the sense of smell, what does it say? It says that the olfactory nerve has been tampered with. You see, it is very important. That is it's a life-saving thing. So that is it, my friends. Before I continue of management, I'm still waiting for some questions. Pterygoid. I've remembered something that my lecturer told us. We have something called the pterygoid. Pterion lies here. So here we have the medial-meningeal artery that rises and goes up to the brain. So if you hit someone here and starts bleeding, after some time the brain is gone. The brain is gone. Okay. Alinik, the most important thing is, you see, your brain has two very important places, here and here. You have heard the Coffee Cake saying this place is called the triangle of death. Here we have something that is called the cribriform plate. So if you hit I have to draw something else. If you hit, your brain has something called cerebrospinal fluid. There's fluid that rotates from the brain to the spinal fluid. It cushions your brain so that it cannot get injured. It cannot get injured from banging to the skull. So when you have hit your head, and then you start nose bleeding, the nose bleeding stops because platelets have done their job, and then you start seeing clear fluid coming from your nose. You go to a hospital. Why? At the cribriform plate that lies here inside, there is a nerve that comes from there that is called olfactory nerve. You know, remember the 10 cranial nerves. The first one, olfactory, optic, oculomotor nerves, trochlear, trigeminal. Those 12 cranial nerves. The most important one comes from the nose, olfactory. So you feel that you are not getting any. You cannot feel, even if smoke comes from air, you will know that it has entered the nerve. Just pack your nose, so that was, I licked out my back for 9 days. Yes, and you remember how it was. Dizziness, headaches, you know. So you pack your nose and you go straight to hospital. Here we have something called the pterygoids, the triangle of death. That triangle of death that our friend the coffee cake is saying. We have the midlumeningeal artery. Yeah? What are the pterygoids? They are called sphenoid bone pterygoid plates. They lie here. Midlumeningeal plate. They lie here and then they come this side of your skull. So there is an artery that is called the midlumeningeal artery that passes and comes here and goes deeper into the brain. So if you are fond of hitting your child's laps, you may be hitting this. If someone hits you here, but within seconds you can die if you start bleeding. So stop slapping your children here. Stop. If you are shouting, stop slapping your children in the head. So Alimig, I've repeated that very slowly, and it is very important you note that. That is the very important thing. It is a life-saving thing that you cannot miss in life. Never miss that. Don't blow your nose when you are seeing clear fluid after nose bleeding. You may be killing yourself slowly. So let's continue to management, or any other person who has a question. Any other person who has a question? Any other person who has a question? We continue. Any other person who has a question? I can see more people still around, but they are just listening and jumping out and in. Good, thanks for listening. And please share my videos. We go and get more subscribers. We need to grow and a big family, family that takes care of health, If we grow and finances start to come in good, I'll start a foundation. From this channel, I'll start a foundation whereby if one of us is in US and needs assistance, we can fly there with some people. We go and assist that person medically. You see, that is my assumption of growth of this channel. If a person is in Namibia, if a person is in Asia and is one of our supporters and needs assistance, why not? Why can't we fly there? Because growth of a channel is it's growth of some revenue. I have a question. Yes, coffee cakes. Yes, continue. Please continue. If a channel grows and revenue is coming in, why should you not support people that are supporting you? So if a person is here and needs a surgery and my channel is doing good, why should I not fly and go and help that person? That is what I'm always trying to pray that my channel grows and I start being a doctor who visits all my. If I leaked the fluid out, how does it return? You cannot return. If cerebrospinal fluid comes out, you cannot return it. But the meninges of your brain, there are some cells that continuously release the CSF at the brain. You see, there are some cells in your brain that continuously, they are called choroid plexus inside your brain. They are called choroid plexus. They continuously produce cerebrospinal fluid. You cannot return cerebrospinal fluid that has come out of your, because it may be that, and that is a thing, anything that is micro that goes into cerebrospinal fluid, dangerous. So you see, so I was talking and saying, I was like, I got no fluid. No, it continuously produces and they balance. There is a balance that they are having. So My people, that is always my dream. Channel growth, we start supporting people. If one of us is going to theater and I'm in Africa, and we can pick some of us, we go to see that person, we support that person, and we bring that video here. If one of us is having a medical issue and we want to go through with this person, why should, if a channel has grown and it has got many subscribers and we are having it, and it is a medical channel, it is supposed to help people medically. So the finances are supposed to go out there and help people. Or the way we are helping people with knowledge now, because the channel is still down, finances are not yet in. So when they are come in, that is what I will be doing. When the channel goes, what I will be doing? Create a good facility for people in Africa to help themselves, and start flying to help people out there who need medical help. You see, so share this channel and always come and share and listen and learn something medical. It is a medical channel, and health is diverse. Health is for everyone. There is, even if we have tropical diseases in Africa, even if we have tropical diseases in Africa, the physiology of a human being is same. The physiology of an Asian, different colors, one people, different colors, one people. The physiology is one. The treatment is same. You see, people are suffering out there with medical bills. They are suffering there with good medical the issues that you can help. So why can't this channel grow? Why can this channel grow and start helping those people? You see how my friend Marwa helps people through the channel. That guy brought up a channel, and the channel is helping the society plus other people out there. Plus other people out there, because some of the people that are gaining from YouTube, they are a result of Marwa. So Marwa is helping people socially. School fees, building houses, helping people to come with YouTube, getting something to get something to eat, taking some children to school. When a channel grows, give it to the society. So if this channel grows, we give it to the society. We work in hospitals. We see complications. Mothers that have not paid bills, struggling. We help. You check it. So let's go to management. That was a half. We call it half break or what? Yes, that was a break. And let's go to management of. Let's go to management of this thing. I've gone social until I've slowed down. Let's go to management of nose bleeding. Let's go to management of nose bleeding. Yes, Alinig, it's very important to be your brother's keeper. And you will see it. God is going to bring this channel big, and you will see me doing that. Right? You saw Jamaican uncle saying he already knows what I'm doing. I do it, but at a low scale. I do it at a low scale. I want to do it at a bigger scale. I want to do a hospital with MRI machines where people can be coming, they get free MRIs. Free. Because in hospitals, there are some equipments and some tests that are so expensive, and they are making people have late diagnosis. Here in Kenya, I'm in Kenya. You are sent for an abdominal MRI of around 30,000. This is a person who lives below $1 a day, and you expect that person to get that MRI so that he can take back to the doctor for a diagnosis. That will take a month. If it is cancer stage 0, which is can be treated or 1, this person comes back. This person comes back with cancer stage 3 now. I will become emotional. I will become emotional, my friends. I will become emotional. Yes, coffee cakes. Imagine. So a person comes back with an MRI. Yes, he has gone to the village to get to solicit some money to do that MRI. And when this person comes back, what happens? The staging has gone to the next stage. So you cannot treat. You cannot. Just imagine. My friends, just imagine. I hope, I wish God blesses me with some. Let me not be emotional. Let's continue. Management overview. You first aid of nose bleeding. What do you do? Onik is here. Onik, my buddy, how are you doing? Long time no see. Onik, you disappear, you come, you disappear, you come. People miss you. Why? Tell me, why did you I really thought you were mine. Now, sit upright and lean so that blood cannot go backwards. Pinch nose part here. Can you do ultrasound X-ray? Yes, of course. The coffee cakes. Yes, I can. And the X-rays. Those are minor radiology imagings. Now, you pinch, you sit this. You pinch, you sit like this. You will be pinching the little area, the anastomosis. If you are bleeding from here, it will help you to stop it. Alibig, yes, you understand. Thanks so much for understanding that. So you will be pinching the little area. Do a cold compress so that the vessels can constrict. So you can take some vasoconstrictors, like adrenaline. When you spray or you take adrenaline and spray it, your veins, the arteries constrict. When they constrict, what happens? When they constrict, the bleeding stops. You pack the nose, like you pack so that the clotting can continue to work as you stop the bleeding. You pack the nose. I'm good, Onik. I'm very good, Onik. Onik, you run away so much. Okay, just don't have a MRI machine. No, right now my facility is an outpatient facility for now, but we have partnered with a friend whereby when a person comes in the facility and I want to do an X-ray, I've partnered with the person who is a radiologist who has the machines. I don't have the MRI, I don't have the ultrasound, I don't have the X-ray. My part is medical and laboratory. Medical and laboratory. So the imagings, I partnered with him. So I go there with my patients, they are done, they come back, we check. That is, I thought the coffee cakes you are asking if I can do in training. If it is machinery of X-ray and ultrasound, we don't have. That one I've partnered with someone who has them. But we do laboratory only. But if God helps me to get them, it will be a breakthrough very soon. So Onik, you are a runaway boy. Runaway boy. Don't run away. Onik, I need you here every day. You know you are my buddy. You with Savior man. You don't run away. Yeah? Coffee cakes, I thought you were saying if I can do them in practice. I can do them, but we don't have the machines. Only lab tests that we do. Yeah, we have partnered. Now that is good. Now we were talking about management. So nasal packing is important, but you lean forward so that blood cannot, treat underlying cause, blood pressure and clotting disorders. If you have clotting disorders, you need to be treated in hospital. And there are some tests that you do at the hospital that, like the clotting factors, all of that, clotting factors. And in nose bleeding, if it is continuous, there is nothing much you can do. There is nothing much you can do. The only thing that can be done if it is continuous is in the hospital, because there are some people who can nosebleed until you have to go for surgery, to help those veins to be right. I understand. Thanks for understanding that. You see, there are some people who Njoroge, noise bleeding, like for example, if you break a noise of someone. David Njoroge, repeat that again. Noise bleeding, like for example, if you break a nose of someone, you have written there noise bleeding. We are talking about nose bleeding, David Njoroge. David, hi. Which part of Kenya are you watching me from, or outside? Which country in this world are you watching from? Now let's talk about, if you have any question about nose bleeding, ask. I've gone through the Lodwar. Yes, I remember Lodwar. But you told me you live in the camp. There is a friend of mine who is there right now. I link up with him. He's a very good buddy of mine. From this person is from Nyayo House, but now he's in Lodwar. Especially hemophilic. Hemophilic means hemophilia. Hemophilia is a blood disorder. We have hemophilia A and hemophilia B. Let's see. That is a blood disorder whereby you have a factor hemophilia A. There is a blood. I'll train people about how the blood clots. Factor 8, and we have hemophilia B, where you have a problem with factor 9. Sorry for my spelling error, but life is different. Yes, Joro, life is so different. Please share this to your fellow friends in Lodwar. Blessings, Devi. I got go help my dad. I got a thanks for being here, T Beauty. Even I can see my time is just about to end, but before it ends, there are some things that we need to talk about nose bleeding. Some facts about nose bleeding. Some facts. T Beauty, you are always a funny girl. Nose bleeding always means high blood pressure. No. If you are nose bleeding, don't think of blood pressure first, but always. You may take the BP to confirm that your blood pressure is not high, but please go to hospital. High blood pressure does not directly mean you have nose bleeding. However, it can make bleeding harder to stop. Your bleeding is hard to stop because your blood pressure is high. You should tilt your head backwards and when you are nose bleeding. Some people say you tilt. You have seen people doing it like this. That is a myth. Tilting the head backward is dangerous because blood flows into the throat, which can cause choking, nausea, and vomiting aspiration into the lungs. You should lean forward like this. But this post, I won't kind of try to write in English, but they let me. No worries, Joro. No worries. You know, in my here, in my channel, we don't judge and we don't talk much. We respect each other. Myth, nose bleeding are always serious. No, some are slightly. Most nose bleeding are mild and harmless, especially in children. You might see children nose bleeding and then after some time, because of their tender anastomosis here, I'll get nose bleeding with really bad migraines, but not a lot, but it will happen for time to time. Migraines, when you have headaches, it means when you have headaches, it means you have maybe BP is high, then the little area is bleeding, or dryness, which is causing headache. You see, yeah. Picking your nose causes no real harm. Hello team, let's support each other on social media platform. I'm Queen B, I will support you back. Yes, Queen, everyone who is here, most of them have their channel. So if you know, like Queen is saying, hello team, let's support each other on social media platform. I am Queen CNLB, I will support you back. Queen, post your, if anyone can help Queen to post your link, please post your link here for people to follow. Post your link, people to follow. So picking your nose can cause no real harm. Be careful when you are picking your nose. I've told you there is a little area here that is anastomosis. There are blood vessels that are connected. You may injure them. So be careful. Putting tissue deep inside the nose stops nose bleeding. No. This can actually worsen by damaging blood vessels. When you're putting tissues and packing, and then you remove, it may bleed more worse. Nose bleeding only happens in dry weather. That is not correct. Dryness increases risk of epistaxis. Nose bleeding is called epistaxis. So dryness increasing epistaxis. Splitting blood means the bleeding is from the mouth. No, I've explained why. When you spit blood, it means that you are not bleeding from the little area. You are bleeding from the posterior palatine artery. So be careful about it. Be careful about it. You should keep blowing your nose to clear. Never. That one we have said no. Blowing nose, be it nose bleeding or even when you have flu. So those are the things that we have discussed it, and I can see the people are here. Everyone is here watching and listening to me. Now it's time for you to give me some questions about nose bleeding. About nose bleeding. Anyone with any question before we continue to another thing that is very important? I wanted to talk about headaches. And
kwa majina naitwa Ronald.
I think headaches are it's a very important topic. What do you think, my friends? Yes, Queen has said just Google Queen C. Parkinson pink stone. Queen C pink stone and it will pop up. Queen C pink stone and it will come up. So I wanted to talk about headaches, and headaches is a very important topic because not all headaches are the same. Habs, hi. Today you have missed a whole epistaxis session. Headaches. Not all headaches are same. Anyone who knows how headaches come in? Anyone knows how headaches come in? How you feel headaches? I talk about stress. Talk about stress, please. Stress is physiological stress and emotional stress and social stress. Stress is a word. Habs is saying we talk about stress. There are several types of stress, but as we continue, let's talk about, do you understand how you are, there's something I want to show you here. You see the blood vessels. So when I was talking about the pterygoids and cribriform plates, the pterygoids of your brain are here. Here are the pterygoids. Dehydration, yes, dehydration can cause stress, can cause headaches. The pterygoids of your brain are here. So when you hit someone here, you may hit these vessels. Midlumeningeal artery is around here. Posterior communicating artery, anterior communicating artery. So I get bad headaches, sometimes migraines to strong smells. Migraines to strong smells. Yes, we will talk about how these headaches come, types of headaches. Let me just go through them. And then I'll go through types of stress. This is I get very okay. Oh, Habs is here. Habs, welcome to the platform. Although the big topic has ended, we have had a very big topic called nose bleeding. Hope you will rewatch. Now let's talk about headaches overview, but there will be a time where we will dig deep and talk. If it is not tonight, we will talk about it tomorrow. We have something that is called primary headaches. These occur on their own, not due to another disease. They just come. One of them is the common term that people call migraines. Usually throbbing, pulsating, and one side. There is a one that is called tension type headache. So migraine is one, tension type headaches, band like pressure around the headache, pressing like this. And then we have cluster headache, extremely severe pain, migraine, tension type, and cluster headache. And then we have something that we call secondary headaches. They are due to underlying condition like sinuses, infection, head injury, blood pressure, tumors, meningitis, glaucoma, all those. Those are the headaches that we will talk about. Primary headaches and secondary headaches. And in primary headaches, we have said migraine, tension type, and types of headaches. We will see where they come from and how we can control them. So as people are coming in and types of Habs had said, I talk about stress. Some meds cause headaches too. Yes. Some medicines can cause stress. So those ones are secondary because they are secondary to some medicines. So Coffee Cakes will talk about headaches as tomorrow, and there are two sessions that we need to talk about headaches, and we need to talk about something that is called coagulation factors, how the blood clots and how your blood is regulated when it comes to clotting factors. So Coffee Cake is saying some meds cause, that one I've answered. Now there is, when we talk about stress, this is for the Habs 5851. When we talk about it, we talk about acute stress. Let's talk about acute stress. lasting for some minutes and then it goes. Chronic stress, we'll talk about it. This one is coming because of long-term continuous problems, ongoing problems like family conflicts, financial, anxiety, depressions, episodic acute stress, use stress, positive stress, helpful or motivated stress. It is called use stress. Preparing a competition, preparing for a wedding, exam preparedness, you see. Distress, negative stress, harmful and overwhelming, severe trauma, loss of loved ones, severe pressure. Those are social stresses that we will talk about them. We will talk about these types of stress. But right about now, we have gone through nose bleeding, and you have seen nose bleeding is just not nose bleeding from the nose. You can be nose bleeding even from the throat, the posterior palatine, and we have given ways to handle it. And if it is continuous, please get this person to a hospital. And then headaches, we have talked about them in overview. I'll talk about them in full as we continue our talks. In the evening today, if you have any question at 10 at night today, please prepare your question. Let's get to know how we can help you to continue with understanding medical issues. So any question, even if it is outside this, Coffee Cakes had said she gets migraines. Yeah. So Coffee Cakes said she always have migraines. Let me go through migraines first before I finish the session. I have like 11 minutes to finish. Migraines starts from the brain and trigeminal nerve, not the scalp of your head. Migraines are headaches that come from the brain and the trigeminal nerve. The trigeminal nerve is one of the 12 nerves. Let's know why. One, we have olfactory, optic, oculomotor, trochlear, trigeminal. So the trigeminal nerve is the 5th cranial nerve comes from your brain. It's activated normally, releases pain chemical like, you see, trigeminal nerve, when you activate, releases pain chemicals like CGRP. Is called calcitonin gene related peptide. They are called pain peptides. They are chemicals that are released by this nerve. This causes inflammation around the brain and blood vessels. So irritation comes from the nerve. Migraine starts in the brain stem, inside 5th cranial nerve, the trigeminal nerve. When it is excited, it produces something called calcitonin gene related peptide. Calcitonin gene related peptide. Blood vessels in the brain, expand and become sensitive. They expand and become sensitive. This continues to throbbing, pulsating headache. So you have seen, look at the blood vessels in your brain. Look, these are the blood vessels in your brain. So the area that the trigeminal comes in is between here. This is called the circle of Willis. The circle of Willis. So when it is irritated, the trigeminal nerve, and it is producing calcitonin gene related peptide, this causes inflammation around these vessels. And when it causes inflammations, what happens? You start having throbbing. Welcome again. Yes, pulsating headaches. Brain chemicals, neurotransmitter like serotonin imbalance plays a big role. Drop in serotonin triggers migraine attack. Also involves dopamine and CRG pathway. So migraine aura area. In some patients, the cerebral cortex temporarily changes activity, flashing lights, blind spots, and tingling sensation. So you, when you are excited, when you are sad, and serotonin has dropped, because pleasure hormones are like dopamine and GABA. You understand? Dopamine and GABA. So when someone is mad and excited, serotonin may drop, dopamine may drop. So it excites and irritates the trigeminal nerve. And when the trigeminal nerve is irritated, what comes out? Calcitonin gene related peptide. When it comes out, it makes your brain to do what? It makes your brain to undergo inflammation. And so you will feel it even here. You will feel it even in your front of the eyes, because both the blood vessels are undergoing inflammation. And that's why most of migraines, if you check it so nice, the doctors that are treating migraines, they use antidepressants. They use antidepressants because they stop some chemicals, and then the balance of serotonin and dopa comes back to normal. It is like a negative effect, and the trigeminal brings back the see. You check. Is getting me that correctly? Welcome. For those that are liking, welcome to the chat. Yes, large amounts to prevent. Yes. So coffee cakes, you understand now why they use antidepressants and not painkillers. Because painkillers stop something that is called prostaglandins. Prostaglandins helps to reduce inflammation, systemic. You get? They help to reduce systemic inflammation. But when you come to something that is called migraine, there is a special chemical called calcitonin gene related peptide that is released in your brain that makes the brain to get inflammation. So when you use something that is called an antidepressant, they stop the balance or overbalance of serotonin, dopa, and GABA. So the brain balance becomes normal. So now you will not, after this, you will not ask your doctor, why are you giving me antidepressants and I'm only having a headache? Because the characteristic of your headache is just brought by migraines, and that's why you call migraines. Migraines is brought by a trigeminal nerve in the brainstem. So when you feel that you have you know and you have been diagnosed with migraines, always talk to your doctor. You'll be having some antidepressants around you. So that you can, when we'll talk about headaches, we will talk about all this. Now, my guys, I have 7 minutes. Who is watching and has not said hi to us? If you are here watching and you have not said hi to us, please come and say hi to us. Come and say hi to us. come and say hi to us as we finish, or any question that anyone has. Abs is saying Onik. Oh, Onik's name is hello. It's like saying hello in Armenia. So anyone who is here who has a question, I have 7 minutes to go. You can bring it. Now, coffee cakes, you understand why you are given antidepressants. So for a person who has migraines, one thing you should do is to stay away from stressing yourself. Always take life easy. Don't always be problematic. You see, don't always be problematic, and everything will be okay. So 5 minutes to go. Anyone who has a question? I don't want to go when my time is still here. Maybe someone is writing a question. Maybe something. There is something going between Habs and Onik. Hello, Onik. Okay. So that is it, my friends. I think there are no more questions, and we meet at 10 Kenyan time. Onik, you are confused. You are on Fiona. I saw our Marie, my daughter. Now you are on Habs. Who do you want? You are Galigalis, eh? Onyx is Galigalis. Onyx is Galigalis. So anyone with any question, my friends, anyone who feels you have a question that is pinching you, and you want to ask the doctor the question, ask any question before my 3 minutes are gone. Today we have learned good things about nose bleeding. People have learned why they are bleeding from. Doctor, I had a migraine daily for 22 days. They put me on amitriptyline to prevent. Then wanted MRI, but turns out I was pregnant. Yes. When you are put coffee cakes, when you are put on amitriptyline, did it work? Did it suppress the problem? Did it work when you are on amitriptyline? You know, when you are pregnant, headaches come because of compensatory mechanism. Your bone marrow and the kidney producing more erythropoietin. You need a lot of blood, oxygen. Many vessels are working, so you get headaches. That one may be another thing also. You see, so congratulations, that was a headache. Hi doctor, sorry I'm late. Things to do. Yes, I understand. As Smiler in the city, you need to take us to show us the Queensland. Guys, please go and see the Queensland through Smiler's channel, please. Doctor, I only love one girl. Her name is Fiona. I just talk to other girls in an interesting way. Onik, you are so fine. I told you to come to Africa and go to Uganda. Me, I'm in Kenya. You come with Fiona in Kenya, I treat you. You come with Fiona in Kenya, I treat you. So, Smiler, we have gone through, I hope you rewatch. We have gone through several things here. We have talked about nose bleeding, and we have talked about headaches and some bleeding disorders partially. I wasn't on for very long, especially after finding it was pregnant. Put me on. So, okay. All right. Leila, you are here. Leila, welcome. Today you are cooking for us mandazi, and I was salivating. Leila, you know your bro here loves sweet things, and you are cooking them when I'm away. Cooking them while Sumatripan, acute migraine headaches. Yes. I want to take the coffee cakes. When you take Sumatriptan, it increases serotonin, and it's the same thing. When it increases serotonin, the other one, that is the trigeminal nerve, does not release the chemical, so it goes down. It goes down. So that is like treating the thing in a reverse way. You get, in a reverse way. The pharmacist didn't want to release the meds. He felt too many. So the doctor had to explain, then release. I was late 20s, but suffering migraines is age 12. Yes, sometimes people who suffer migraines, they are given a lot of antidepressants and a lot of also they are given a lot of antidepressants, and they are given also a lot of painkillers. You know, don't worry, I'll do a party for you only. I will cook everything. Leila, you know I'm a Luya, meaning Mluya. I like eating. The funny thing is, most of the time I don't eat. I am Joash. Most of the time I don't eat because I'm working. Like today I've just taken Coca-Cola, even not a full bottle, half a bottle. Greetings to chat, everyone. I am Josh. Please rewatch this. You are coming late. Please rewatch this and like. Hi Leila girl. Please like the chat. Like the live, please. Let's like to increase more impression. Josh is here. Josh. Thank you for coming through. Thank you for coming through. We have talked about epitaxis. Epitaxis is a medical term to call nose bleeding. We have talked about headaches partially, but we will talk about them in a wider way. And then I've promised I'll talk about how your blood clots when you are cut, and why your blood does not clot inside the blood vessels. You know, you may be surprised. Why is my blood not clotting inside my blood vessels? But when I'm cut, it clots. I will explain that. My first was Midrin, then Sumatriptan injection. No, I just stay hydrated away from strong smell, maybe having migraines for 2 or 3 times a month. I know my triggers. Yes, doctor, I'm drinking green tea now at work. My favorite. Today I've not been brought my green tea. I wish it was here. So, for migraines, my sister, coffee cakes, if strong smells are the ones that are giving you migraines, you should know that they are irritating the trigeminal nerve in your brain. That is the problem. And it releases some chemicals that are making your brain have inflammation. Your trigeminal nerve is sensitive. That is the problem. I am Joash. How are you? So, that are coming in right now, even if you have not had everything, who has any question? Who has any question for those that are coming in? My friend Onyx says he just loves Fiona, and the others is talking to them interestingly. That is being Galigalis, Onyx. Here we call it Galigalis. Galigalis is a person who loves ladies. A guy who loves ladies. So anyone who has a question, my guys, before I cut the lives, or anything that you can tell anyone here. But the Queen has said you go and support her. Please go and support Queen. The second one, Jamaican Uncle has changed the time from the normal time to 2 p.m. 2 a.m. or p.m. Let me see. So those are the updates right about now. So let's check and see for those that are here. Thanks for the 20 likes chat. 20 likes. Do we have 20 likes? We have 19. Be sure to subscribe the doctor for more. Yes, we have how many likes? We have 19. 20. Hey, Kingre, what happened? Why am I not getting your notifications? Hi, I think I've not been seeing your lives, or you are not doing lives nowadays. Kingre, please, if you are not doing lives nowadays, you tell me. And Gabriel, or I'm the one who has been so busy last week. Come on, guys. We have talked about nose bleeding and headaches, and also, but I wanted to talk to Kingre privately. Kingre, if you allow me, I will call you to talk to you. There is something I wanted to talk to you about, the condition that you told me you have. On our side is 23, but on your side is 3. Kingre, thanks for tuning in. I wanted to call you about something. Let me get time tomorrow. Hope I will call you. We talk about the condition we talked about. I had to call even Marie, my daughter, but I didn't have time to call her. Being a doctor. So, anyone with any question? Kingre is so lost. Yes, Alimi, Kingre is so lost. Why? Why, Kingre? Why are you so lost, Kingre? And Sumana is here. Hey, after the topic is just ending, my friends are coming. And Sumana, welcome to the chat. And guys, sorry, last week it has been having a hectic run. Work, family, and you have seen I've not been coming live. It is because of hectic situation. But this week I think I'll be at least better. I'm well, Gabriel. How are you? Gabriel, how is the going? This week I'll be a bit better, and better late than never. Welcome. This week I'll be a bit cool, and I want to now to start linking. I promise to be calling my supporters, all that I have numbers. I'll start with Kingre. I always speak to Leila. Leila is my sister. You cannot sleep without sleeping. You cannot sleep without knowing how your sister is. Leila calls me every time. Leila, nice. This week I have some time. I think I will try to do it. Alimig, I'm doing fine. Do you have a video today? Yes. Alimig, do you have a video today? Anyone who has a video today, please bring it down. We give you shout outs. Give us the links here. Anyone who has. This day has been over. Today we have talked about nose bleeding and headaches overview, but I'll talk tomorrow. I'll talk about headaches, starting with migraines in detail, and the other day I will talk about why when you cut yourself, you clot, the blood clots, but inside your body the blood cannot clot. Have you ever asked yourself why? When you cut yourself, the blood clots and it stops flowing, but inside your body it cannot. Have you ever asked yourself that question? So my friends who are here and listening to me and are talking to me and feeling fine, and don't get so lost. You know, when we are doing this together, we need people to link up, to make the Friends channel to grow. And that's why I'm asking if Judy has been coming online. because I've not been seeing. You know, when I get to work and I take my phone, I put it there, and I open my YouTube on my computer or my TV, I see, oh, King Ray is online. I usually follow that. Even if I'm not following, I usually just put it. But I've not been seeing King Ray. King Ray, hope you are doing fine. Hope you are doing fine. And Sumana, please don't get lost so much. Don't get lost so much. And my brother Gabriel. Gabriel, when was the last time you had a video? You know me, I don't do videos, I do lives. Because the time of coming here, editing the videos, doing so and such and such, for me cannot work. For me, it cannot work. Oh, you had a live and a premiere on Friday. Oh, okay. I didn't see. On Friday was my hectic day. Ali, hope you enjoy my music. I will visit to new songs out 3 weeks ago. Okay. So, my friends, Coffee Cakes is a musician. Please go and enjoy Coffee Cakes music. Go and enjoy Coffee Cakes music. Go and feel it. All of my supporters here channels. All of my supporters here have channels. And I usually say, let me tell you one thing, my friends. My videos are lives. People learn through them so much. So if you put your link on my video, even after, the people that come to learn those topics, they follow those links. So every time you come to my channel, if you are a content creator, every time you come to my channel, if you are a content creator, please leave your link. Please leave your link, because I noticed someone asking me a question on a video that I did 2 months ago, and is a new person asking me on a chat on my channel, oh no, can I get your number? I want to ask you something. And when you talk to that person, this person asked you a question about a mental health question that I did a long time ago. So leave your links here, because my channel is being watched so much after we have done a live. So I think leaving your link, I like people to grow, and leaving your link here will make you to be followed. Yes, you get it, my friend. Every person to leave the link, so that as they watch, they are following too. As they watch, they are following those links. For me personally, I cannot remove any person's link. Even if you talk negatively to me, but you are getting support in a good way, it's okay. So leave your link here, my supporters, and I push them, because these videos, I shared one video to a school on a talk of something, and all the students followed me, and they started following the links that are here. I'm still here in the background, and everyone in the chat. Welcome, Jamaican uncle. So I'm saying I shared a link of a topic to a school, a university, and the students were watching, and they followed the links that were attached. So when you are watching my lives, I teach students sometimes partially, and I send them these links. So if you leave your link here, you will grow so fast, because students are curious and they want to learn. And when they come to your channels, like those students that like music and they follow the link of Coffee Cakes, they will like the music and they will link up with Coffee Cakes. If they come to your channel and they see you love cooking, they will link up with you. Hey, Coffee Cakes, you want people to laugh at me? Yeah. That shot was nice. You go and watch That's great. That's great. You go and watch that video. That is a show from the video, the shot that Coffee Cakes has. Let me see it. The shot that Coffee Cakes has put there is a shot that we were having fun at home. You know me, I'm always funny. I laugh even. Okay, let me. Yes, leave it. Leave it, please. I usually laugh every time, even home, even dancing. I dance with my kids. So let me show you something. Let me show you something. No, management. I leave a link under that, so you can follow it. This is a short. Leila, please post those. There is something I want to show people. So as we continue, if you have a question, my friends, it's good you ask. It's good you ask, you know. And I'm waiting for your links before I go away. Before I go away, and if you have any question, you may ask the question. Ask the question so that let me see. Oh, it's Sato Vibes. Sato Vibes. That shot that that shot that Coffee Cakes has done it there. It was a good vibe in the evening. So follow the link and watch the link under that shot and see marvelous things when I'm with my family and we are laughing and dancing with my kids, my little kids. Yes, my little kids. Sato, it's called Sato Vibes. Sato Vibes. So the links are there. I can see Leila has put the link. Let's get to Raid Doctor's channel. Wow. Coffee Cakes. I usually send my links to university students, mostly that are medical students. And you know, students are very curious. So when they are watching these channels, Everblaze, greetings to everyone here supporting. Everblaze, boom, thanks for coming in. I'm just explaining something. The topic has ended, but we are just having a chit chat. When they are watching and learning, they follow the links of the people that they see are talking. And they ask me, do you really know Jamaican Uncle? I tell them, yes, he's my personal friend. Do you really know Ali Meek? I tell them, yes, we chat with them. Doctor, I see Coffee Cakes is one of your biggest friends. Do you know him? I tell them, yes, all those people that are chatting there, I know them personally. And hope they're coming to your, most of them, you know, when you follow a link on Dreadlocks can't live in a tenement yard. Uncle has started. Dreadlocks and living in a tenement yard. I can't even post my own link load. Wow. Someone help Alimik to post the link. I realized this because a student asked me once, Doc, I can see your friend Live's music, who is called The Coffee Cakes. Her channel is all about music. You love music, can you produce something with her? And I laughed the student. I asked the student, where did you get the Coffee Cakes channel? He told us, we saw her on the channel, we followed the links. You see, thanks Sha Travel. Sha Travels is here. Sha Travels, welcome. We have been talking about nose bleeding and headaches. I've just introduced headaches. So anyone who is here who is a moderator, please help Alimig to post her link. Gabriel, you are a moderator. You know how to do this. You know I'm using a phone plus the computer. So help Alimig to post my channel is all about educational material, and even when I do things that are not educational, when it is feel good evening, YouTube does not push it so far, but I love it because we are enjoying. But when you do educational material, we like it. We like YouTube pushes it, and I see students. Most of the students are really following my channel, and I love it. I love when I'm mentoring students. Sorry guys, at work in the back. Yeah, Sha Travels is a Monday. We understand you are at work. So that is it, my friends. I've pushed the time up to. Hey, let me end at 7. Let me end at 7. And let's see. I'm still waiting people to post to post their links. I want people to grow. We cannot be under 1,000, under 2,000 for so long. I have to push this to university students out there. Let them learn as they follow your links as we grow. Jayhang, how is you? Jayhang? How are you doing today? Jayhang? I can see you are here, and I know when you are here, everything is fine. Everything is fine. Now, let me see. Let me see something. I'm seeing something here. Welcome, my dear friends. I want to post Alimig's channel. That's what I'm finding. Alimig, I found you. This is it. Let me post it here. Alimig, that is you. Doctor, check your settings to allow hypes on your videos. How is that done? Hypes. How is hypes done? Settings. Let me check right now, because after now I'll be so. Jayhank, welcome to the platform. Hope you have liked. Yeah. Let me see how to allow hypes on the platform. So that is it, my friends. That is how can someone please put my link up too, because I don't know how to do it. Let me put uncles. I want your links, because this video I'm going to push it somewhere in a university. I want those people to follow it. As they learn, they are in your settings. When you watch, we can hype some and get. Oh, okay. Let me see. Let me go to Jamaican's uncle to post the link here. Let me see. Jamaican uncle is here. Oh, I have known now how to post this one. Let me see. This one, copy, and let me post. Jamaican uncle, I've found it. That is your link there. I've posted Jamaican uncle. So he has said I go to settings and allow hypes. Coffee cakes, where do we allow hypes? Channel. How I have to go on? It's 4 minutes, guys. Welcome. I'm just about to end. Coffee cakes, it's in your settings. When we watch, let me see how to allow hypes. If you have not posted, I'm waiting you post your channel, because this one I have understood. Yes, guys, please hype each other's channel. Yes, you log into your studio, go to settings, advanced, check box that says let viewers hype. Oh, okay, channel, then advanced settings. Okay. Yes, my guys, I'm waiting. That is a new thing that I've learned to push the channels out there. You know, you must be creative. Yeah, you must be creative, because if you just you know, students are always curious, and they will always want to follow links and see what people do, and they really do what. Let me see here. Oh, I've seen coffee cakes. I've seen. Let me see this. Yes, I'm giving some scroll across, doctor. I'm seeing. Okay. Yes, I'm waiting while I'm learning this thing that the coffee cakes have given me. Yes, my guys, to hype a video, swipe left where you leave comment. If able to, you can hype the video. I believe you only have 3 hypes a week. Oh, I see that. You see how I'm learning things slowly by slowly. Allow third-party companies to train models using my channel content. Allow. Okay, I will hype it next time. Now, anyone, the coffee cake, this is to you and ever to hype a video, and lots of people don't want to post links on their channel. Why don't they want to post links? And we want to grow. I only see this on monetized channel. So, I'm monetized. So I just monetized and let me see, general access. Okay. I will do it. I'll follow it slowly by slowly and allow it. So my guys, my time is out, and I can see anyone who is left with any question. Anyone who has any question, I will come. Uncle will be here. Greetings, Dr. Ben, and everyone in the house. Welcome, humble Marcia. Welcome to the channel. Thanks for coming in. Make sure you leave me with your like, and all the new people that have come today, thanks for coming in and your subscription. Please pin. Oh yeah, okay. Thanks for everyone who has subscribed and supporting me and everyone. Smiler, it's not a link. You hype the video. It's a button says hype. Oh, okay. Yes, coffee cake, I know. Okay. Let's train each other to. There is a video here that is helping me. Oh, I've seen it. So, anyone who is here, 27 likes. Coffee cakes. Anyone who is here who has a question, my friends, today is an open channel and we are asking random questions. Open channel with random questions. Anyone who feels like you have a question for me, you can please watch this video. We have really learned about something that is very important. We have learned about nose bleeding, and we have learned about something that is called headaches. I've just introduced. So we will always continue giving topics that are relevant. Topics that are relevant, topics that are relevant are topics that help each other to grow. Topics that help each other to grow. So there is a way that I do things, me, and I'm always open for my growth. I meet university students that are medical students, and I send them my videos, and some of them come across them who are my friends also, and when they are watching it, they go through the links that you've pinned there. So when they are watching through the links that you have pinned, they follow and support you. So when you are coming in my channel and you have a channel, don't ask, just post your link. Just post your link, because a link is easy. Someone may go through it and easily go to your channel, but when it is your name, it is hard at times. So thanks for everyone who has supported me for this day. Let's meet at 10 when I'm answering, at 10 Kenyan time, when I'm answering questions concerning the topic that we have done. And then tomorrow we will deal with headaches, starting with migraines and how to control. Baraka pia wewe. Baraka is blessings. Everyone. Leila is telling me, are you still talking? you Isis King, I need to meet you. So let's meet. Let's go to Jamaican Uncle. Jamaican Uncle is coming at 9 Kenyan time. 9 time. And then I'll be coming after Jamaican Uncle to answer questions. Anyone who has a video today? Is anyone having a video today night? I'm waiting before I go. Anyone who has a video today night, so that we can uphold you and come to your video. After Jamaican Uncle, we come to your video. Anyone who has a video? Okay, my guys, bye. See you when I'm answering questions at 10 Kenyan time. May you be blessed. Bye bye. See you guys. Oh, Leila has a video. Please, what time, Leila? Before I cut, what time? Leila, I'm waiting. What time is your video? Leila, my sister, what time is your video before I go? Okay, nice one. So bye guys, let's meet at that time. May you be blessed.